Well,
I think that there are some things that predispose some people toward having excessive anxiety. In other instances, I think folks can, for psychological reasons, have more of a propensity toward anxiety. Yeah.
Hey everybody, welcome back to the Reclamation podcast. I am excited to bring you today's conversation with Dr. Stephen Pearce. Dr. Pearce is nothing short of a genius in my opinion, and in our conversation today we get to some really big thoughts around anxiety. If you've been following along this entire month, we're focusing on the topic of anxiety, kids, sports and anxiety, and just anxiety in general. Dr. Pearce in our conversation today talks about how to cope, gives us some really, I think, very palatable coping mechanisms around anxiety. He also introduces a way of thought about anxiety as an everyday occurrence for most individuals, and the difference between anxiety from like a human behavioral standpoint and anxiety from a clinical disorder standpoint. So I think you're really going to enjoy this conversation. And if you're loving this conversation around anxiety, maybe it's really striking home for you, there are a couple things that I want to encourage you to do. The first thing is check out what's happening over at Restoration Church. We've been preaching all month on the topic of anxiety and what the Bible has to say about it. The sermon series is called Everything's Fine. You can look that up at restorationcenterville.org or on our app, Restoration Centerville, found in the iTunes Store or the Google Play Store. The second thing I want to invite you to do is to share this episode with a friend, because we know that coming out of isolation and talking about the hard stuff together makes us all grow. So without any further ado, I hope you enjoy my conversation with Dr. Stephen Pearce. Hey everybody, welcome to the Reclamation Podcast. I'm Tony, and I'm excited to bring you today's episode with our featured guest, friend, confidant, counselor for the last 7 years I've known you, Dr. Steve Pearce. Steve, how the heck are you?
I'm okay. I'm a little nervous about doing this.
Are you nervous?
Yeah.
Now, you and I have talked countless times. So let's just treat it like a conversation. And for everybody who doesn't know you, kind of tell them what you do, where you went to school, why your voice might be an interesting one on the conversation on anxiety.
Okay. Well, I'm a clinical psychologist in private practice in North Dayton, Ohio. Where did I go to school? Undergrad. I don't even know if you knew this. Undergrad, I went to Ohio Northern University, which is a Methodist university.
Yeah, polar bears, right?
Yeah, polar bears. Yeah. And from there, I went to a doctoral clinical psychology program in Northern Illinois University. Left there after the master's temporarily to get married, and while I was gone and out working, I found the state of Ohio opened up a new psychology program that was exactly what I wanted to do. The one in Northern Illinois was a PhD program, which is those are really pretty much research-based, research-oriented programs, and I didn't want to do research. I wanted to see people. And a school opened in Ohio at Wright State, a doctoral program that would teach people how to help people instead of teaching them how to do research. And so that's where I finished up my doctorate.
And so you're a people person, which is important for this conversation. How long have you been in practice? How many people have you think you've seen in your lifetime? Let me ask you that. Ballpark.
Thousands. Yeah.
I love it.
I think so, yeah.
And how many years have you been in practice?
I was licensed actually I was working clinically before I was a psychologist. After my master's degree, I came out and was certified as a substance abuse counselor. So I've been actually since 1978. That's when I started working with folks, period. I've been a licensed psychologist since 1984.
So 40 years.
Good solid 40.
Yeah, it was easy for me to do the math since I was born. I was born in 80.
So I was seeing people before you were born.
And I think that gives so much credibility to your voice. So I appreciate this. And as you and I talked a little bit off air, we're doing this series on anxiety and how it affects people's lives and what it looks like. Could you give us your definition of anxiety?
I knew you were going to do that.
Well, of course I was. Now, we've defined it. We've defined it in the series as a feeling of uneasiness, worry about possible events that could happen. That's not very clinical. How would you define it in your experience, even not even clinically?
Anxiety is very much like fear. Physiologically, anxiety pretty much is fear. The difference between fear and anxiety, in my way of thinking, is that fear usually has a very specific stimulus, very specific target. I'm afraid that this lion in the room is going to rip my guts out.
Yeah.
Yeah, okay. Fear. Anxiety is usually a little vaguer than that, sometimes much vaguer. Some people have feelings that feel physiologically like fear, and they don't even know what it is that's causing it. They just know that they get these unpleasant sensations like shakiness, it might be chills, it might be sweats.
I mean, for me, it's shortness of breath. Like if I would assume that that's anxiety. Like I was at Disney World and we were in a crowd of people, and I just started getting overwhelmed with the crowd. Would you call that anxiety or fear?
Were they wielding weapons, pointing them in your direction?
No, but they all
then
had.
I'd call it anxiety.
They all had. they all had those like necklaces that light up. No, I'm just kidding.
Yeah, anxiety for sure. Yeah. Yeah, because that wasn't in a situation where like anybody would feel afraid.
Right. So it's more because my wife loved it.
Yeah.
And she was like in heaven. Like
Right.
It was 4th of July. There were 100,000 people in the out front of Cinderella's castle, and the only thing I can think about is I've got to get out of this space.
Yeah, that's great. That's a great example of an anxiety response.
Okay, good.
Yeah.
Good. So, how much do you see anxiety in the people that you talk to on a regular basis? I'm reading some statistics out of the National Health Institute that say 31% of adults are dealing with anxiety. Do you find that to hold true in your meeting with people?
Anxiety is a part of living.
Tell me more about that.
Well, most human beings deal with anxiety more or less from time to time, to a greater or lesser extent. It's, but yeah, I would guess high 90s percent of human beings will experience anxiety in their lifetimes. The few who won't might be like an extreme sociopath, somebody who's just completely cold-blooded and has no feelings for anyone whatsoever. But the normal person will definitely have anxiety as part of their normal experience. When you say 31%, I imagine you're talking about like pathological or diagnosable anxiety. And the National Institutes of Mental Health, this is a statistic I read recently, have estimated 19 or 20 million Americans have a diagnosable or have had a diagnosable anxiety disorder. So that's under 10%. But they also, National Institutes of Mental Health says anxiety is the most frequently encountered mental illness. And I said that with air quotes because
I was going to ask
anxiety
about
is a part of normal experience.
Okay.
So to call it mental illness, all that means is you can attach a label to it sometimes if you need to do so for insurance purposes.
So, what I think I hear you saying is that anxiety is healthy? Is that...
No, it's normal.
Okay.
Yeah, it's normal. Is it healthy? If there was a lion in the room with us, then it would probably be life enhancing for us to be scared.
Sure.
And to have some kind of a physiological reaction to that, to have like the blood pump harder out of our hearts and through our bodies and to our muscles so that we can fight the lion, or so that I can like hit you over the head so that I can run and the lion can eat you instead of me.
Thank you.
Yeah. There are healthy aspects to a fear reaction. Anxiety is a little more troublesome. Anxiety usually isn't especially helpful. That's what differentiates it, I would say, from fear. It's usually just kind of more bothersome and annoying and discomforting, and yeah.
So where does anxiety come from then?
Nebraska.
Damn Cornhuskers.
I don't know. I'm not sure how to answer that question. I mean, Freud would probably answer that it comes from the unconscious, but Freud did cocaine, and he had a lot of weird ideas. On a physiological basis, it's characterized by a sympathetic nervous system response. So things you've associated with, like the term adrenaline rush.
Yeah.
Yeah. The physiological aspects of anxiety come from the sympathetic nervous system. And are things like increased blood flow peripherally, to the muscles so you can fight the lion. Dilated pupils so that you can see better. Your body will stop digesting food and start, preparing for an emergency. Basically, it's an emergency response.
Got it.
And that's one of the things that's so long-term unhealthy about chronic anxiety, that your body's constantly preparing for emergencies which do not occur. So then you end up with physiological costs of preparing for war all the time, and then war never happens. There's never anybody to fight.
Oh.
Does that make sense?
Yeah, no, perfect sense. In the Army, there was a term that we use, sounds a lot like it, called battle fatigue. And it's from staying in that hyped up sense for way too long. And then what ends up happening is they would get that 1,000-yard stare that basically they're always looking to respond even when there was nothing to respond to.
Yeah, yeah.
Mm-hmm. So we've established you've been in practice now for 4 decades.
Uh-huh.
How have you seen anxiety change in community in the last 4 decades? Do you think it's more prevalent now? Do you think it's more talked about? Is it the same?
Honestly, I got nothing.
So not noticeable then.
I may not. It may be that I just sort of walk through life without thinking in those terms of what's different culturally. I think I sort of walk through life just trying to understand the human condition. The human condition being something that has been such for thousands and thousands of years. I try to understand what it's like to be a human being.
Yeah.
And so I'm more likely to process things on an individual basis and just to try to understand, so what are you experiencing and what's that like for you? And I think that the experience of anxiety for people, for individuals, is probably very similar now to what it was 40 years ago, or for that matter, 5,000 years ago.
Yeah, I would imagine.
So I probably haven't, I just haven't been living my life in such a way that I think I have any information relevant to the question that you asked.
Well, honestly, I think that's part of why you're so good at what you do, is because you take people on such an individual basis that you don't generally think about things culturally. And part of why I was asking is because one of the trends that I've seen in this conversation around anxiety is the impact of the internet and social media
to anxiety as people are now, like you said, trying to prepare for something that may never happen in terms of comparing themselves to other people in likes and hearts and all the things that happen on social media. So it's been really interesting for this discussion around kids and anxiety, because one of the coaches, Coach Ullery, who was on the podcast, he said that he's coaching kids who are always thinking about what they're going to put on their Instagram account or Twitter or, Snapchat streaks or things like that. And that's a different part of the anxiety equation for him.
Well, in my day, the way I can relate to that is when I was in junior high, high school, and college. I think that I was still in the process of trying to decide, am I okay? Do other people like me? Am I a valid person? Stuff like that. And I think that a way that I tried to do that was to get the approval of other people whose opinions I cared about,
sure,
which was my peers at that time. And so, I would attend to, what's the right thing to say in this situation, and, what are popular ways of talking, and what words should I use, what phrases should I use, how am I going to fit in and be one of the cool guys, and that kind of stuff. And so the way I process what you're talking about is that adolescents are still trying to do the same thing nowadays, only they're trying to do it instead of through the way they phrase things, it's what they say on Snapchat or what they say on
the videos they're
whatever.
Posting, right?
Yeah, exactly. But how do I do it right in a way that's likely to be approved by my peers and that's going to make me, popular or acceptable, right? Or So it's the same dilemma, just in a different time.
Well, right, and I have to wonder about scale a little bit. Just the number of peers that you have access to and could speak into your life at that point in time was probably limited to campus or to whatever environment you're in. And now in this scenario, the scalability on that is literally hundreds, if not thousands, of people who are dialed into your social media. But at the core level.
I get what you're saying, and I think you're right. There's a lot more variety of content out there. At the same time, the developmental task of formulating an identity and coming to accept oneself or not, I think it's still the same fundamental task, and I imagine that there's a limit of how much we can attend to.
Sure.
So... I think that the scale is bigger, but the task may not be bigger. Does that make any sense?
No, if anything, the task has probably remained,
the same.
Yeah, for 5,000 years, like you said.
Right, right.
So would you say that the number one task in this kind of, I'm going to say, battle with anxiety, is it identity?
No, there are lots of things that folks can be anxious about. And that assumes that anxiety is a psychological condition.
Oh.
At least that's how I'm understanding what you're saying.
Yeah.
Because you're saying, what is anxiety about? And the about part seems to me to infer that anxiety is about something.
Yeah. So if it's not not a psychological condition.
There's been some research that a guy, I think his name was Kagan, I'm not sure, did that I'm going to misrepresent in a way that still characterizes it.
Sure.
So if you imagine that this guy got 100 babies and put them in cribs and lined up the cribs. And so he walks behind the first crib by the first baby and claps his hands.
Yeah.
And you see the baby, have an orienting response. They'll look around. They'll look for what the sound is. But, the baby's still cool. They're still okay. And so he does that behind every crib. He finds that 1 out of 10 babies, when he claps his hands, will go like, wah! And have like a big startle response. And as he followed those people through life, my understanding of his research was that he found that those babies that had that big startle response were more than average prone to anxiety. It's like maybe they're hardwired with a predisposition toward anxiety. So if you take research like that and try to generalize it, I think perhaps there are some folks who are, for some reason, which is probably inborn, more likely to develop anxiety disorders than, the other 90% of folks are. And so in that way, it's hard for me to think of it as purely a psychological phenomenon. But, I had a professor in college who was overgeneralizing a bit, but he said in general, if you ask a psychologist a question, then you can count on that their answer is going to be, it depends. So I think that's what I'm saying here it depends. Well, I think that there are some things that predispose some people toward having excessive anxiety. In other instances, I think folks can, for psychological reasons, have more of a propensity toward anxiety. Yeah. So it may or may not be. It's a somewhat, for some people, psychological issue.
So what I do hear you saying though is that with 90% of the people that you see have wrestled with some sort of anxiety, that it's kind of a.
And this is people I see at church, people I see at the mall.
Everybody, right? Everybody.
Baseball games,
right? All the best places,
right?
That it's both and there is a human condition of anxiety, and then there's a whole different category for a psychological condition of anxiety. Is that am I saying that right?
I think what I'm saying is that for anxiety to be really big, problematic, troublesome, pathological, that sometimes the contributing factors might be psychological in nature, and sometimes it might just be that the person has an unusually strong propensity toward anxiety.
Got it.
Yeah.
Got it. So I have long valued your wisdom on how to deal. I know. I'm buttering it up because I'm about to ask for something. Wait, what? How do we deal with it? That's coping mechanisms. What are some of the things? Now I know that you've helped me tremendously in my lifetime wrestle with some of these things.
That's nice. Thank you.
You're very welcome. How when the average person comes in, how do you help them or guide them to coping?
The absolute truth is, if somebody comes into my office with a diagnosable anxiety disorder, I virtually always suggest that they read a particular book that someone study and practice a particular book that somebody has written. This particular book is the best book I've seen to help folks with an anxiety reaction. What I like about it is I think it's accurate. I think it's true. And he's sat down systematically to think through, so how would I go about, helping people with an anxiety disorder? What do I need them to know? What are some skills? How can we systematically use these, so that we're building on the foundation that we're laying from chapter to chapter? Somebody's already done that thinking. A whole lot of people have.
Sure.
But I'm lazy, and I don't tend to want to think all of that through piece by piece for myself. So I just help them work through a book where the person has already systematized that process.
And that's this book, right?
Yeah.
Anxiety, Phobias, and Panic.
Right.
By
Reneau Peurifoy.
I'm so glad you said it.
You're welcome.
Yeah. So that's with somebody with the diagnosable, clinical. What about the 90% that you run into everywhere else? Like if you're just talking to the normal Joe or Jane on the street who's got occasional anxiety, not the full-blown condition, what are some of the things that you recommend either in the moment or just to kind of tactile stuff? Like, for example, one of the things that you've always told me is to use the word fantasize instead of just I think this will happen. And instead, one of the things that I say is I'm fantasizing that this will happen as a way to help remind myself that it's a fantasy, it's not actual.
That's an example of what's called a cognitive behavioral intervention, which means that the way we think about stuff, the way we label stuff matters. And if I can remember that this thing that I'm having fear about isn't a real thing that exists in the world right now, but rather something that I'm imagining might happen, then it can help me to get less agitated about it if I remember that it's not really happening. It's a fantasy. This isn't a thing that's occurring in the real world. And if I can keep that in front of me, then I'm going to react less to it. But it's easy to get carried away with one's fears, with one's projections into the future, and to imagine them as real, and to think that, oh my God, what am I going to do with this? And so anything I can do to help my thinking be more realistic and less I'm having trouble with words, less dramatically scary, is probably going to help me to some degree to control my anxiety. So yeah, another thing that's an example of that is just staying in the present. Oh my gosh, this horrible thing might happen in 6 weeks, or it's there's a whole lot in our culture about politics, and approximately 50% of the people are afraid of one set of things that might happen if,
right,
and the other 50% are terrified of the other set of things that might happen if. And culturally, we spend a great deal of time trying to prevent the disasters that might happen if, political things occur. I think we would all be better off spending less time worrying about what might happen and spending more time in the present. At this moment, I'm doing okay. Right now, I'm sitting in my office talking to you. I'm comfortable, with the exception of my bladder. So I have to go to the bathroom.
Well, you are drinking 32 ounces of coffee.
Yes, I am, and enjoying it enormously. But trying to stay in the present moment. Usually nothing terrible is happening in the present moment. So that can be another good coping skill. Just stay here now. Be in this moment, right this moment.
Do you systematically kind of check through your person when you're doing that to stay in the moment? Like, is it just how am I feeling from my head to my toes kind of thing?
That's one way to do it. That may or may not go well. Like if a person's in the middle of anxiety, then their bodily...
Oh, their body could be changing physically, right?
Yeah, their bodily sensations might be really disturbing for them. So to have them focus, for example, on the speed of their heartbeat might not be a good idea. So whether you want to go internal or external depends on what your present
and what your
instantaneous psychological
what your typical
is.
response is.
So for some people, it can be more helpful to ground externally rather than internally.
Yeah, in this room, it is
around,
quiet.
Look at the thing on the... Yeah, exactly.
Yeah.
Right? I don't see any lions in the room. It looks like I'm safe. There's nice pictures on the wall. The air is a comfortable temperature. I can feel the skin on my buttocks against the seat, and I can feel the soles of my feet on the floor. This is
Yeah, grounding.
Yeah,
Yeah.
grounding, exactly.
That's
Staying
excellent.
right in the moment, right now,
And
rather
that's
than
what
projecting into some kind of potentially terrifying future that in reality does not exist at this moment.
So let me ask you this.
Uh-huh.
We both live in Dayton, and we were, kind of just recently had this traumatic.
Yeah.
Yeah, I mean, horrible.
Awful.
Yeah.
Yeah.
I can imagine that there are people who are going to walk into crowds differently because of a fear that has been rooted in something they've seen that is true.
Oh, absolutely. Yeah.
Do you have any thoughts for that person?
To try to soothe their anxiety?
Yeah. Well, I honestly, I don't even know if it's anxiety or fear or because it's. I mean, I guess if there's.
It would be, for me, it would be a variation of anxiety because, there is no active shooter in the moment.
Right.
So, like, if I walk out of my office and I feel afraid walking out of my office because of anticipation that there could be a shooter out there, I would say that's anxiety, and I would say that I'm generating it by focusing on, this event that doesn't exist currently externally to me. It's possible, and I've just become aware of the intensity of the possibility, but yeah, I need to be able to manage that in order to live well. I need to be able to manage that, even though that it's real that people die tragically and unexpectedly at the hands of maniacs with guns. I don't want to let that be the centerpiece of my psychological existence. I don't want to be focusing on that all the time. I don't want to plan my life around that. I don't want to live my life around that possibility. For me, that would constitute psychological disorder if a person, because there were shootings in Dayton, oriented their entire existence around that and decided not to leave their house ever.
Yeah.
That's psychological disorder. It interferes with day-to-day functioning. For some people, and I don't want to say that anybody who's having a struggle with that today is psychologically ill. That's not what I'm trying to say. You might be having, to some degree, some symptoms of what's called an acute stress disorder. An acute stress disorder is a short version of the better-known phenomenon called post-traumatic stress disorder.
Okay.
It's post-traumatic when it occurs when you're still having symptoms a certain distance in time away from the event. It's an acute stress disorder when you're really close in time to the event.
Makes sense.
Okay.
Yeah.
And folks do react to things, and certainly anybody who was intensely exposed to the shootings that just occurred last weekend may very well be having psychological effects of that. Those folks are not mentally ill. They're reacting to what happened. Generally speaking, what you want to do in a case like that is find somebody knowledgeable and talk about what you're experiencing. I think of acute stress situations like that as being something like a splinter. If you have a splinter, what you want to do with the splinter is, if you have to, get a set of tweezers and dig around in there and pull the splinter out, because if you don't pull it out, it's going to get infected.
Oh, that's so good.
So
and it'll
talk
hurt.
About
it'll hurt.
Well, yeah. I mean, if you wait long enough, you could end up with massive scars or a serious infection that goes to your bloodstream.
Right.
Really bad things can happen. So you don't want to leave it in. You don't want to push it in farther. You want to get it out. So the way to get it out with a psychological event is to talk about it with others who are knowledgeable, who can help you process the experience. That's why crisis counselors, get busy, after a time like this, just to help people process
Yeah, appropriately so.
these things. Yeah.
Yeah, appropriately
so.
so.
The splinter doesn't turn into a
Massive infection.
massive infection.
And you end up having to cut the whole hand off.
Exactly.
Right.
Yeah.
Right.
Exactly.
And then that will really impact your day-to-day life. Yeah, that weaves together very nicely.
Yeah.
So, Steve, I know that you are a tremendous man of faith, and that we've talked about it numerous times. How do you look at anxiety through the lens of faith? How does that intersect together?
Really significantly. Ultimately, when anxiety is being psychologically driven, faith has the potential to be a complete answer to the anxiety. If I believed in my heart completely that God is always in control, that God is always good, and that all things happen as a result of His gracious plan. If I really believe that through and through, I don't imagine I would ever have anxiety.
Wow. Tell me more about that. Fill that in for me.
Well, because for me, it's just sort of a logical statement. If everything's happening exactly the way God wants it, every minute of the day, all the time, everywhere, and if God is completely good, and if God is completely in charge, nothing's wrong.
Right.
What's to be scared about?
Sure.
But the reality is that I don't believe that throughout the depths of my spirit all the time. And when I don't, then it's easy for me to imagine that, oh my gosh, this is wrong, or, oh, I might have this illness and I can die and that would be terrible, or this person might be mad at me and they might say terrible things about me, and other people might think badly of me and that would be horrible, or I guess what I'm saying is it requires me to be believing something other than God's in complete control and everything's going in accordance with His will in order to be anxious. If I believe that all the time, I wouldn't be anxious.
Right. So then, do you use your faith then as a coping mechanism in your own life? Just asking.
There are times when I'm able to successfully do that.
Now, you chose your words very carefully.
Well, yeah. The truth is, I'm human, and my faith is less than perfect. That's my reality.
Yeah.
So, I know God is real. Sometimes, and sometimes more, sometimes less, but sometimes I struggle with, but is God really for me or not? Am I okay? Am I enough? Am I on God's good side? I struggle with, that's my own psychological struggle. That's a manifestation of my own personal insecurities. And it impacts my ability to completely believe my theology. Even if I think God is love, because John said so, God is good all the time. He's always good. He always loves me. He's always concerned what happens for me. Even if I believe that in my head, I struggle with it psychologically.
Kind of accepting it in your spirit.
Yeah. during those gaps, I am quite susceptible to anxiety. Am I making sense?
Oh, it's beautiful. Actually, it's beautifully
Yeah.
said. I think it makes a lot of sense that if you happen to be a person of faith and you can lean into your faith, it should it should counteract. Ideally,
one might be able to use that to minimally soothe and potentially eradicate any anxiety that you're experiencing. But in my own personal experience, my ability to do that is quite fallible. There have been times when I've been able to harness enough faith that it really impacted my instant anxiety. There are other times that I find that I'm not able to garner enough
right.
to successfully impact my current fear.
Well,
So,
perfect example. The Disney World example.
Yeah.
I wasn't thinking about God then.
Yeah,
I wasn't thinking
yeah.
about my faith. Theologically, I know all those statements that you made are true.
Yeah, yeah.
But yet, in that moment, all I could think about is, whew, it's getting hard to breathe in here.
Yeah.
What's going to happen with all these people? Da da da, et cetera, et cetera.
Yeah.
Why is it so
Right.
hot underneath this stupid poncho? Right? Like,
Yes.
all of the feelings there.
Right. So I think faith is a wonderful tool, ideally the best tool to use to counter anxiety. But I also think that my own growth in faith is a gradual process. And I guess earlier in my life I was a pretty black or white thinker.
Yeah.
And I always used to imagine, well, you should just be able to do, this and do it perfectly. And that has not been my experience of the human condition. I don't find that other people are able to do whatever, 100% and perfectly, and I know I can't. So even though ideally faith would be the perfect counter to fear, to anxiety, pragmatically, I think we each need to go through our own growth process to get better and better and better at having genuinely that kind of deep faith.
Yeah.
For me, it's been a gradual process.
Well, certainly Wesley would say that that's the process of sanctification.
Okay, yeah.
That gradual increase of becoming more like Christ.
Yeah.
And in that have this, from Christ's example, perfect faith.
Yes, exactly.
But I'm with you. I feel so far away from that most days that I can see where it just gets real squishy.
Yeah, it gets real squishy. But the matter isn't that it's not God's inadequacy; it's my lack of faith. Oh, ye of little faith. If you had but the faith of a mustard, the size of a mustard seed or whatever.
Right.
You could move mountains.
Yeah, that's...
A mustard seed looks way big to me some days.
Amen. That'll preach right there. That'll preach right there.
Yeah.
So, if you were to go back and look at your own life and anxiety, what advice would you give young Steve in the dorm room trying to please his peers or to find the right words? What would you go back and tell a younger version of yourself about anxiety?
Well, it wouldn't be about anxiety. It would be about reality. It would be about you are loved. God loves you.
Yeah.
This is the reality. God loves. You are loved. He created you just the way He created you. It's okay to be just as you are. You don't have to look for the right cover, the right mask, the right disguise
Yeah.
to be accepted or to be loved. It's okay for you to be just the way you are right now. Now, on the other hand, I would humanly say, but you got a whole lot of work to do, so don't stop that process either. Just because God loves you doesn't mean that you're all that. It means it's okay to feel safe in the world. It's okay to be vulnerable enough to self-examine. It's okay to not be perfect, to know that you're not perfect, and to begin to embrace your imperfection and try to do a little better. But you don't need to completely build a false front in the image of those peers that you most admire and respect. Your peers aren't God. God is God.
Yeah, that's probably really timely for a lot of our listeners, I think. Yeah, your peers aren't God. God is God.
Yeah.
That's powerful. That's powerful. Final words on anxiety for anyone who's listening and might be wrestling with how this plays out in their life or the life of someone they love?
Okay, one thing I want to say about anxiety is we haven't talked a great deal about clinical anxiety, about levels of anxiety that are so severe that they are causing life problems.
Yeah.
For that, man, I just want to encourage anybody that's listening, if you're having anxiety that really interferes with your ability to live life happily and well, contact somebody about it. Get help with it. You don't have to be able to figure it out all by yourself. And in fact, it's going to be really hard to figure it out all by yourself.
Yeah.
There are some people that have some tools and have some skills. Contact them, use them, let them be of assistance to you. Don't try to figure it all out yourself. That's too hard. There are 4 components to successful anxiety treatment. And one is education. One is learning about anxiety. The book that we mentioned earlier is a good source of information about anxiety.
Yeah.
2 is something called relaxation, and that doesn't mean sitting down on the couch in front of the TV and drinking a beer. The relaxation in this sense is a very specifically defined term, and what it means is the regular performance of any specific activity which, when practiced at a certain level, can reliably result in invocation of parasympathetic nervous system functioning. That is to say,
Yeah, I was going to say,
relaxation is one of any number of things like self-hypnosis, progressive muscle relaxation.
Got it. Intentional mindfulness.
Mindfulness.
Yeah.
Guided imagery, any of those things, which if you practice them enough, then you can train yourself how to get yourself from an agitated state, like from an adrenaline reaction, into a more relaxed state.
Yeah.
Yeah. So, so the second leg of the 4-legged stool of anxiety treatment is learning a relaxative method and practicing it to the point where you can actually use it functionally to bring yourself down.
Yeah, okay.
When you're struggling with anxiety.
That makes perfect sense.
Okay. The third leg of the stool is something called cognitive behavioral technologies, or cognitive restructuring, or basically what all that stuff means is developing some skills in the analysis of your own thought processes, so that when your thinking is illogical and harmfully illogical, so that, for example, if you're scaring yourself with worries about the future, you can learn some technology for analyzing your own thoughts and modifying your thoughts on purpose, so that eventually you're believing different things and then you're not so scared.
Got it.
That's most of the hard work of anxiety treatment, is the cognitive restructuring part, learning how to rethink things. And probably each of us is making a lot of thinking errors that we don't by ourselves know that we're making. So that's one of the places where contacting a knowledgeable person, a psychotherapist or whatever, can be really helpful in folks getting somewhere with their anxiety. And they're going to have a lot of trouble doing that all by themselves.
Yeah,
it's
absolutely.
hard to see your own blind spots.
Yeah, for sure, for sure.
Okay, and the fourth leg of that stool is medication, and there are helpful medications for anxiety. Anxiety is one of the areas where I would advise that people don't just lean on medicine. Even if the medicine results in symptom removal, with anxiety, some of the anxiety reduction medicines can, over time, be something that you develop a dependency on. So doing psychotherapy and medicine for anxiety is, in my opinion, better than just doing medicine. But medicine can be something that's helpful in the short term to help sort of make a dent.
Yeah.
Yeah. Okay. So don't try to do it alone is my best advice.
And I think that's so important for all of us. And,
Yeah.
And that goes for our faith walk as well. Like,
Yeah.
I mean, we're not going to
Yeah.
grow in our faith.
Same thing. Can't see your own blind spots.
Can't see your own blind spots.
Right.
Yeah, that's...
I've appreciated some of the ways you've tried to put dents in my
well, thank you. Thank you.
In my theological in the theological thoughts that get me in trouble.
Sure.
Yeah.
Sure. So I know people are going to ask, if they're in the Dayton area, are you taking patients? Because they're probably just going to fall in love with you over this interview.
Yeah, that's likely. Yeah, I am.
You're in a different season of your practice.
Yeah, right. I'm lazy. I work part-time. But yeah, I guess this is my answer to that. If something is striking somebody and they're sort of feeling led to contact me, if the Holy Spirit's leading you to contact me, I really want.
Sure, yeah.
Yeah, I really want that.
I'm
not, on the other hand, actively out
searching for
hunting
clients. Right, yeah. Right.
Yeah.
And what's the best way for people to contact you? Website? Call the office?
No. Like I said, I'm lazy. I don't even have a personal website. My partner in a group practice that I co-own has done the hard work of creating a website for that practice, but the place where I see my own clients, I don't even have a web presence. The phone number of my practice is 937-454-1541. When you hear my voice come on the answering tape, then just press 115. That's my personal mailbox.
Got it.
Yeah.
Got it. Well, Steve, thank you so much.
Thank you, Tony,
for the time today and for all that you, all the wisdom you dropped here. I think
you are so kind.
Oh, thank you.
To say things like that. Yeah.
Well, it's certainly my pleasure. It's certainly my pleasure.
Hey, everybody. Thank you so much for taking the time today to listen to our conversation with Dr. Stephen Pearce. We hope that you found it life-giving. I don't know about you, but I particularly loved the part that he talked about his faith and his theology and his humanness. I found that to be just an enriching part of the conversation. I'd love to hear from you. What did you love about this conversation with Dr. Pearce? What did you find interesting? You can always hit us up at twmilt.com or on Instagram, twmilt, Facebook, twmilt. We would love to hear more from you about how God or Dr. Pearce spoke to you in this conversation. As always, the highest compliment that you can give us is to share this episode with a friend, maybe somebody who's never listened before. We would love to continue to share more about how to balance faith and life. Thank you so much, and we'll see you guys real soon.